Hello and welcome back to your MedTech training. How exciting! We're on video number 5. We are next going to review the MAR. That stands for Medication Administration Record. So when we are dealing with a med pass, there are 2 extremely important documents that we should be reviewing prior to giving the medication. One is the physician's order. That is the actual order that the doctor has sent over to us and the pharmacy for the medication. On that order, we're going to have the patient's name, date of birth, the medication, the route, the dosage, and the frequency are 6 rights. On the MAR, that's the Medication Administration Record. This is where you're going to see all of the medications ordered by the physician or sometimes physicians, because our residents have multiple doctors because they are medically sometimes complex. And that is what you will use when you're actually on the floor. So before you go out on the floor, you're going to grab your orders, make sure they match up with your MAR, and then when you're on the floor, your MAR is what you're going to be using to pass out the medications. So we are going to watch this next video.
Administration Record, or MAR, holds the instructions for medication administration for all your clients. You must always refer to these records when giving medications. Never give medications from memory. If your agency uses pictures with the MAR, check the picture prior to giving the medication. Check that the picture in the MAR matches your client. At this time, you can also check for other information on the MAR, such as a client's known allergies. When reviewing the client's medication administration record, you should first identify which medications need to be given routinely. If your client needs a PRN or as-needed medication, you can prepare this medication at the same time. After you have identified which medications are to be given, unlock the cart and unlock the medication doors. Place the keys on top of the cart within your field of vision. As you remove the medications, one at a time, you will begin the first of 3 medication checks. The first check happens when you remove the medication from where it is stored. The second check happens just before or after opening the medication and preparing it for your client. The third check happens before you give the medication to the client. With each check, make sure that the medication name, dose, date, time, and route listed on the label matches the information listed on the MAR. You must do this for each medication. Again, check to be certain that you have the right medication, dose, route, time, and client. Before pouring liquid medications, always shake the bottle well. When you remove the cap, place it upside down to prevent contamination. Turn the label toward the palm of your hand to protect the label from spills while pouring the liquid. After pouring the correct amount of liquid, replace the cap on the bottle. Take the medication cup with the measured dose and set it on a level surface to double-check the amount measured at eye level. This method assures you have the correct dose. Try to avoid working over the MAR to prevent spilling on the records. When removing pills, Pour the correct number of tablets into the lid. If you pour more pills than are needed, pour the extra pills back into the bottle. Pour the correct number of pills into the medication cup and replace the lid on the bottle. Using the lid to measure out the pills prevents contamination of the medication. As you return the medication bottles back to their storage place, you will perform the third medication check for each bottle, checking the medication name, dose, date, time, and route against the MAR. Before leaving the cart, close the drawer. Close and lock the medication cart doors and lock the cart. Close the MAR to prevent unauthorized persons from viewing private medical information. You are required by law to protect your client's privacy and to keep their personal health information confidential. Remember to pour a cup of water for the client to drink with their medications. After the client takes the medication, return to the cart and document that the medication was taken by initialing the correct spaces on the MAR. For each PRN or as needed medication given, you must initial the MAR and document the time and reason the medication was given. Always follow your agency's policy for documenting the time and the reason for administering the medication. Agencies vary in the way the medication aid is to document their initials and signatures. Some have master signature lists, while others have you sign the signature section on each MAR sheet. It is important to follow your agency's policy and complete this documentation so that other personnel can identify who gave the medication. Always indicate Med Aid or your agency's position title behind your name when documenting medications given. This will identify you as the medication aid. When you finish, close the MAR book and move to the next client. When a client asks for a PRN or as needed medication, you will need to check to see if they can have it at this time. If the medication is a controlled drug, it will be kept in the locked controlled substance medication drawer. You must unlock the cart and the controlled substance drawer to get the medication for the client. Remove the right medication from the drawer. Compare it to the MAR to make sure you give the right dose of the right medication to the right client at the right time and by the right route. Refer to the controlled substance sheet and verify the remaining count of this medication before removing the needed number of pills. The numbers must match exactly. If they do not, alert your supervisor immediately. Remove the needed number of pills and place them in a paper medication cup. Document the number of pills you removed on the controlled substance sheet, completing all required information, including signing your name. Record the number of remaining pills at the end of the row and carry that total to the start of the next row. Fold and attach the sheet to the remaining medications and return them to the drawer. Close and lock the drawer and then lock the cart before taking the medication to the client. pause for review and practice.
Okay, so we are talking about the right time. That is the fifth right. To be given to the resident no more than an hour before prescribed or an hour after. So when you're working in an assisted living facility, we are looking at a 2-hour window of when a medication can be given. So for example, if a medication is ordered to be given at 8 a.m., medication can be given between 7 a.m. to 9 a.m. Time includes correct frequency of the dosage, and always check when the last dose and frequency was given. So for example, if the medication is to be given every 4 hours, then we really got to make sure it's within that 4-hour window. So if it was given at 12, we really can't give it again until at least 4 o'clock. We can't give it at 3 because some of these medications can have a really bad side effects. So when it comes to medications that are closer in frequency, that 2-hour window thing kind of goes out of the way. What you're looking at is potentially a 30-minute window, but don't do the 2-hour window because then you can overdose. Some medications must be given before a meal or after a meal. And then the 1-hour window doesn't apply at all to PRN medications. So if the doctor says, every 4 hours as needed PRN, then we are not going to look at that window time frame at all. It's going to be 4 hours from the last time it was given when it can be taken again. So for example, if the medication was given at 4 and now it's 10 o'clock at night, we can actually give the medication again. Now, if it's 4 p.m. medication given, and the client is saying at 7 that they're having a pain issue, we cannot unfortunately give that medication. We have to wait until the 4 hours has passed. So the next video we're going to watch is on medical abbreviations and frequencies. Please bear in mind that I do not want you guys, when you're filling out the medication administration record, also known as the MAR, do not write abbreviations. This video is just to educate you, just in case an order from a physician comes through with an abbreviation. When it comes to abbreviation that you're not familiar with, call the doctor and ask them to rewrite it without the abbreviation or ask for clarity. Please do not just assume. Always check with the pharmacist or pharmacy along with the physician.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to talk about medication administration routes and their abbreviations. So let's get started. As a nursing student or new nurse, you want to be familiar with these abbreviations because you may be on the floor and you may hear some other nurse say, oh, the physician ordered that PO, or I need to give this IM or IV or sub-Q, etc. And you want to be familiar with how that route is used to administer medications. Now, one thing you want to remember about abbreviations, like whenever you're documenting or you're taking orders, is that you're using approved abbreviations set by your employer. Most employers will have a list of abbreviations that you can use whenever you're documenting or taking orders, because some abbreviations can have multiple meanings and they want to prevent medical errors. And if you're ever in doubt about an abbreviation, you can always just write it out. First, let's talk about medication administration routes that deal with the mouth. So a very popular term you're going to hear in nursing is PO. And PO simply stands for a Latin term called per os. And what this means is by the mouth, through the mouth. And this is a very popular way to give medications. We give many tablets, capsules, and liquid medications through this route. Then we have the sublingual route, and the abbreviation for this is SL. So sub means under and lingual means tongue. So we give the medication underneath the tongue. Now, a medication you may encounter as a nurse that goes under the tongue is like nitroglycerin. So if your patient's having acute chest pain and it's ordered, you can give them a nitroglycerin tablet, and hopefully that'll help relieve their chest pain. Another route we can give through the mouth is called the buccal route, and it's abbreviated BUCC. And this is where you place the medication in between the cheek and the gum. So we're giving this through the transmucosal route. And some medications that can be given this way are certain forms of opioid pain medication, smoking cessation products, and etc. And since we're talking about the mouth, I want to throw this out there. So another popular term that you're going to hear in nursing is NPO. So what this is again, it's Latin, and it means nil per os. And that just means nothing by mouth. So PO was by mouth, but when you put the N in front of it, it means that the patient can have nothing by mouth. Now let's talk about medication administration routes where we give the medication directly into the vein. Now to do this, the patient is going to need IV access in a vein somewhere, usually on their arms. And you're going to see a very popular term known as IV. And IV stands for intravenous. So whenever you're giving anything IV, you're giving it directly into that vein through some type of IV access. Now, some other lingo you may hear about whenever we're talking about the venous route is like IV piggyback, and it's abbreviated IVPB. So with this, what we're doing is we have a main line of fluids running. Let's say it's like normal saline, and then we're going to hang another bag. It's going to have shorter tubing, and it's going to hence piggyback or connect into that main line of tubing with the normal saline in it. And usually what we do this with is like antibiotics. And then another common way we can give directly into the vein is through an IV push. So intravenous push, you may see it abbreviated IVP. And this is where we draw the medication up in a syringe and we push it into their IV access. Now let's talk about medication administration routes that use an injection or the skin to deliver medication to a patient's body. So one way we can deliver medication is through the IM route. IM stands for intramuscular, and we give many vaccines, even some types of antibiotic and hormone therapy through the muscle. Another route is through the subcutaneous route, and this is where we use the fat within the skin's tissue. Now, it's abbreviated as sub-Q. So some medications that you will encounter as a nurse that will be administered sub-Q are like insulin or anticoagulants like heparin and enoxaparin, which is known as Lovenox. Then we have the intradermal route, and it is abbreviated ID. Now, this isn't as common as, let's say, the sub-Q route or the IM route, but this is where an injection can be given into the dermis, which is found between the epidermis and the hypodermis. So what can be given this way are like allergy tests or the MAN2 skin test, which is the TB test to test for tuberculosis. And as you can see here in this picture, this patient is getting this test and they're giving it via the intradermal injection. And notice that their skin hence bubbles up. It creates a wheal. And then lastly, we have the transdermal route. Now, this is not given via injection. Instead, something is placed on top of the skin. Now, this is abbreviated as TD. So medications that we can give via this route are like medicated patches or ointments that are applied to that top surface of the skin. So we're placing it on the epidermis and it's going to be absorbed into the bloodstream. Now, some medications that you may administer like this are pain relief medications like fentanyl patches, and if you work on a cardiac unit, like nitroclopramide cream, like the nitro bib that you can put on the chest to help with chest pain. Now let's talk about some miscellaneous medication administration routes that you are going to encounter as a nurse. So one way is through the inhalation route, so inhaled, and it's abbreviated INH. Now with these medications that require this, they will enter into the respiratory tract. So any inhaler your patient may be prescribed, or nebulizers like breathing treatments, and you'll see respiratory therapy administer these types of treatments many times. Next is the intraosseous route, and this is known as the IO route. Now this isn't very common because it's used in emergency situations, and this is where access is placed in the marrow of the bone. So they may use this site whenever there's a code blue situation and you can't obtain IV access, it's like failed, so they can give medications and fluids through this route, which is going to enter into the vascular system.
I was eating because I was stressed out, candy bars and chips and donuts, gaining weight. But since I started
and then we have the endotracheal tube route. So if your patient has an endotracheal tube, medications can be given through this, but this is just for emergency situations whenever access can't really be obtained any other way. So what you'll be giving is like emergency type drugs through it. And you'll see it abbreviated ETT, and medications will be instilled through this and they'll be absorbed through the alveoli and will cross over into the bloodstream. Now only certain medications can be given through this breathing tube, and how you can remember it is you can remember the word laned. So lidocaine, atropine, naloxone, epinephrine, and diazepam. The eyes are also another route that can be used to administer medications. Now, whenever using this route, you'll want to write out the word eye, and you want to designate which eye, like the right eye, the left eye, or both eyes. Now, they no longer recommend using the abbreviations OS, OD, or OU to abbreviate for this route because it can get confused with other routes. In addition, the ear can be used as a route of medication administration as well. And just like with the eye, it's best to write this route out and designate, is it the right ear, the left ear, or both ears? Before AS, AD, and AU were abbreviations used for this route, but that is no longer recommended. Medications can also be given through the rectum, and you can see this abbreviated RECT or PR. PR stands for per rectum. In addition, medications can be ordered vaginally. So you may see this abbreviated VAG or PV, and PV stands for per vagina. Medications can also be instilled in the nose, so nasally. So the patient can have some type of medication ordered nasally where you would just squirt the prescribed amount in each nostril. And lastly, medications can also be administered through some type of tube, like a feeding tube. So one way is through a nasogastric tube. You may see this abbreviated NGT. And this is where a tube is inserted through the nose, down into the esophagus, and into the stomach. And another popular way is through a PEG tube. PEG stands for percutaneous endoscopic gastrostomy, and this is where a tube is inserted surgically, so they insert it through the skin and it sets inside the stomach. Okay, so that wraps up this video on the different types of medication administration routes and their abbreviations. Now don't forget to access the free quiz that will test you on this material. Hey everyone, it's Sarah.
Than just him, because if you lose him.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to talk about medication administration routes and their abbreviations. So let's get started.
Sorry you guys. Okay, so the sixth right is the right documentation. So the reason why we went ahead and played abbreviation videos is because that does play a part in medication. When a medication is administered, it must be documented. Your documentation of your medication administration must be done at the time you give the medication. Do not I will say this, if we catch you or hear of you passing out your medications and then going back and filling in your medication administration record, MAR, before or after giving the medication, you will receive a write-up. As you're passing out medications, this is when you're going to document that the medication was given. If you give a medication late, you must document the actual time that you gave the medication. You also must fill out a form in the communication binder as to why. If the medication is not given, you must document why it was not given. And also, this is going to be done in the medication MedTech communication log. This is something we'll go over with you once you're on the floor. You also are going to notify the doctor of missed medication. If a medication is missed more than 3 days in a row for any reason, whether it be resident refusal or medication was not available, you must notify administration staff immediately. To be honest, we should not hit that 3rd day with the medication not being given. So just keep in mind, if your patient missed their medication yesterday for any reason and they didn't get it again today, you're going to notify us. You're going to circle your initials when the medication was not given. No pencils no pencils can be used, and no whiteouts can be used. If you make a mistake, you're going to have to cross it out and initial it. Do not use whiteout and do not use a pencil. And do not pre-initial medications on your MAR. It must be done as you're handing the medications out. So we'll go over this again when you're on the floor, but just note that you should not be pre-filling out paperwork or post-filling out paperwork. All adverse reactions or uninspected side effects or medication errors need to be documented in the resident's chart. You also must fill out an incident report. You also must notify administration staff and fill this out in the MedTech communication log and notify the doctor immediately. If a medication adverse reaction is severe that has caused the resident to have difficulty in breathing, chest pains, or anything else like that, call 911. Written report of the incident is not to be placed in the resident's file. It's actually going to go into the IR binder, which is something we'll show you when you're on the floor what the IR binder is. Always sign the MAR immediately once the medication is given. I cannot stress this enough. Do not pre-fill out your MAR. Do not post-fill out your MAR. Fill it out as you go. Because if you're pre-filling that out, how do you know if the medication was actually given or not? And do not just take medications without your med cart or the MAR. No blank entries on the medication record are not allowed. So, if you're passing out your meds and then you go back to look and you notice there's a blank spot, this is your opportunity to reflect, right? Maybe Mrs. Smith wasn't in her room. Maybe she was in the dining room. Okay, I got to go back and find Mrs. Smith and make sure I give her medication. And if it's blank and Mrs. Smith doesn't take her medication for one reason or another, this is going to prompt you to go ahead and fill out the communication logs that you need. We really recommend that you take maybe a couple of the blank sheets of missed medication communication logs with you, so that way when this happens, that Miss Smith refuses her medications, you can kind of pre-fill that form out, and then you can finish document when you get back. And that paper is going to just prompt you that, hey, Mrs. Smith refused to take her medication. Once again, big red letters here, never document before a medication is given. There may be times when a medication order is faxed in from a provider and they might use abbreviations. And if you're not familiar with abbreviation, please contact a supervisor for further instructions, call the pharmacy, or call the provider. When writing orders out on the MAR or putting them into the EMR, do not yourself use abbreviations. Now, we have some of you who are going through LV in school, had just gone through LV in school, or might be an LVN. I cannot stress this enough. I'm a respiratory therapist. I know a lot of the medical abbreviations that are most frequently used. I have to stop myself sometimes as well and not use abbreviations, because we got to remember, not everybody on our staff has had medical training. So therefore, we have to make it as simple as possible and no abbreviations. Also, sometimes abbreviations can cause an error if we don't do the right abbreviation. So please, no abbreviations. So if you get an order with abbreviation, I'm just going to give you guys some examples, just so that way you're kind of familiar with it. But remember, don't write them. PRN, as needed. You will see this with set parameters as every 4 hours for pain. So this is something that you'll see a lot of pain medications, Tylenols, codeine, Norcos, so forth, will be a PRN order set. QID, sometimes a doctor might write Tylenol, PO, PRN, QID. You're going, whoa, wait a minute. So Tylenol, as needed, by mouth, 4 times a day. So QID, 4 times a day. TID is 3 times per day. BID is 2 times per day. PO, by mouth. Q4, this is another popular one that you might see. The capital Q stands for hour. The number is the frequency. So you might see an order that says albuterol Q4 inhalation. So that means we're going to give an albuterol medication. It's an inhaled medication every 4 hours. Q6 every 6 hours. Q12 every 12 hours. Another popular abbreviation that we might see is before meals, which is AC, or after meals, which is PC. All right, video time, reading a MAR and passing out medication. So this next video is going to give you guys a pretty real life med pass. This is a very long video. Kind of note, when you're actually doing medication passes, it's not going to take you 45 minutes per resident. This video really goes into great detail all of the necessary steps to be able to successfully pass out a medication. Here we go.
So we're going to go over the process of safe medication administration for our patient. So before we start, we're going to wash our hands. And part of our first check, one part of it, is just verifying that the physician's orders are correctly transcribed onto the medication administration record, or MAR, and that it's for the right patient. That's not necessarily always a step done every time you give medications. If the MAR is being used for a while and is signed by both a transcriber and a nurse, you don't necessarily check those physician's orders every time you give medications. But in lab, we're just getting into that practice of reading physician's orders, etc. So we are going to get you to follow that process within sort of your first check. So We'll get started here. We want to make sure we have the right patient first and foremost. So last name Harrison, first name Adolf, and that's right patient here. We can also verify or want to verify with another unique identifier. So in the case of his MAR and physician's orders, the FIN is going to be on there. So the correct FIN number 123 123 456 456 789 789, and then could check the birthday as well, so January 3rd 1946, and Dr. Chris Dirksen is following him, and so Dr. Dirksen has signed the orders accordingly. So now we're going to go through the orders and make sure each individual medication is correctly transcribed. So that's where we're going to follow our rights again. So we have right patient. We're going to go with right drug here. So ibuprofen, right drug. Suspension, I should say as well. So ibuprofen suspension, right drug. Right dose is 100 milligrams, so 100 milligrams. Right route is PO. We have PO. Right time and frequency, so right time is Q6H, so Q6H, which means every 6 hours. So I also want to verify that these frequencies that are transcribed here are correct. So we want to have them be every 6 hours, so 02:30, 08:30, 14:30, and 20:30. Today is May of 2018, May 7th. So we're going to look here. The nurse Patricia Brown did in fact give the 02:30 dose of ibuprofen. She's already signed for it. So we're going to be giving the 8:30 doses of all the medications. So good, the ibuprofen is correctly transcribed. The next medication we're going to look at is the metoprolol. So right drug metoprolol, right dose 75 milligrams. Right route is PO, so by mouth, PO, right route. And right time and frequency, it's once daily. So we want to make sure that there's only one time written here, so that it's not inadvertently given, say, 2 or 3 times a day. So yes, once daily at 8:30. So we're going to be signing for that one, because that's the time. Next medication we have is ciprofloxacin. The next medication on the orders is metronidazole. So I'm just going to look for the ciprofloxacin, and I see it here. Sometimes they aren't always in the exact order, depending on when certain medications were ordered or when they were transcribed. So right medication, ciprofloxacin, and you want to make sure you're saying the whole word and looking at the whole word. So ciprofloxacin. Right dose, 0.3%. Right route, it's going to go into it's eye drops. So it's going to go 2 drops to right eye. So eye drops, 2 drops to right eye. And right time and frequency is daily, or BID, excuse me. So BID is twice daily. So you want to make sure that your frequencies written here are 08:30 and 20:30. So they're separated by 12 hours, and he's going to get this medication twice in a day. The last medication we have here on the MAR is that metronidazole. So right drug, metronidazole. Metronidazole here, and topical. Right dose, 0.75%. Right route, apply to acne rosacea affected areas. And daily. So we're just going to do this metronidazole at 08:30. So right time and frequency is there as 08:30. So once we're done verifying those physician's orders, we can put those away typically back in the chart. You want to make sure that other people can access them when they need to. And we're just going to work off the MAR for now. So we're also going to check on the MAR. It typically will have allergies indicated. NKA stands for no known allergies. NKDA stands for no known drug allergies. So based on the MAR, this patient doesn't appear to have any allergies to any medication. So we're probably safe to give these for that reason. We will, of course, re-verify with the patient always if they have any allergies before we give the medications. So the other part of the first check that we're going to do is pull the meds from our stock supply or from our Pyxis machine, and compare them to our MAR, however they come out. So the first one, again, is that ibuprofen. So I might have to look a little bit around in here. And I think I found it here. So the right drug, ibuprofen. It's an oral suspension. So right drug, ibuprofen, and suspension. It's a suspension. The right dose is 100 milligrams. So we can get 100 milligrams per 5 mLs. So that's a reasonable concentration, and we can get our dose or required dose from that. The route is PO, and this is an oral suspension. It says right there. And then the Q6H we went through already. It's 8:30, so that one's due. Now is also a good time to check for expiration date on your container. So in this case, we're going to see an expiration date here on the side. It's not expired, so it is safe to give. The next medication we're going to check or find is metoprolol. So right drug, metoprolol. So here we have metoprolol, and you want to make sure that you're seeing the right drug name there. So metoprolol, the right dose is 75 milligrams. So they come as 50 milligram scored tablets. They have the little score on them. So we can reasonably get that 75 milligrams by doing 1.5 of these. So we have the right dose. PO, these are oral tablets. They can be swallowed. And then daily is the time and frequency again. So he's just going to get it once today. And again, we're going to want to check for expiration date on here. And there is not, it's not expired. So next medication is ciprofloxacin. So it's an eye drop, so good to look for the eye drop medication. And you want to make sure again that it's just ciprofloxacin that's been ordered. So we have ciprofloxacin, HCl, which is a common additive to medications, but it doesn't have any other medications in it. So right drug, ciprofloxacin. It's 0.3% is what we need, so you definitely want to make sure that it's 0.3%, and it does say that here, 0.3% as base. Eye drops is where it's going, so the route. So it says ciprofloxacin ophthalmic. Want to make sure it says ophthalmic and not something like otic, which would mean giving it into the ear, because those droppers can look fairly similar. So ophthalmic, we're making sure. And then we're also going to check again the time and frequency, and he's going to get it twice daily. So 8:30 is one of the times. And we're also going to check for any expiration date, and this one is also not expired. So perfect. Next medication we're going to check, and it's the last one in our container here, metronidazole. So metronidazole, it's a topical cream, so it says topical cream here. Topical 0.75% is the concentration of the medication, so 0.75%, good. We can get that. Apply daily to acne rosacea areas. So for topical use only, not for ophthalmic. That's helpful. We're not going to put it in their eye, and we're going to just use it topically on their acne rosacea on their face. And then it's once daily, so at 08:30. So we're going to give this one at 8:30. And again, we're checking for expiration date, and it's in fact also not expired. So that's your first check. We have all of the correct medications, and we know that we can get these doses from them, and that none of them are expired. So now we can go ahead and start preparing our medications. So we'll just get a tray ready for ourselves here. And we'll start at the top here with the ibuprofen. So oftentimes you will want to shake suspensions. Here, oral suspensions. This suspension has that top piece in it, so what we can do is stick our oral syringe in here, put down our cap on the side, and we can draw out the correct amount. But more often what we will do in lab actually is pour it, just for practice here, pour it a little bit of excess, and we're going to draw up our 5 mLs. So we go over this in a different video, about how to get that correct amount. So we drop a little bit of excess. We're going to hit those bubbles right out of there, right out of the bottom. We recapped it just so we didn't spray medication everywhere. We're going to now pull back a little bit and holding it straight up and down. We're going to fill the syringe all the way to the top, making sure no more bubbles here. And then we're going to discard our excess there. So we have 5 mLs. I like to actually use the paper cup to cover it. And I can put it down on my container there, or on my tray. Immediately after preparing the medication, I'll just put this aside for now, preparing the medication, you want to make a label. So I'm going to put the patient's initials at the top, and the drug name is ibuprofen. The dose was 100 milligrams. The volume was 5 mLs. We didn't use any sort of diluent. The concentration, it says concentration per ml. You can write 100 milligrams per 5 mLs, or equal to 20 milligrams per ml. And then the date and time you're going to want to put that you prepared it. And it's 0810. And you can sign or initial on the bottom. That's mostly just for you. And when you attach, you want to attach your syringe immediately. In this case, our meds are all going to look quite different. But just in case you have a bunch of, say, white pills in different containers, you want to make sure you're labeling them carefully and just getting into that habit right away. So you can actually peel back the back of the label here, just a little strip of paper off of it. They're cut that way in lab, and you can attach it to an area of the syringe where it won't cover those volume markings, so it won't obscure your view of how much is in that syringe. Whoops. You want to make sure it's good and on there, or at least right underneath your syringe. So there's our ibuprofen is ready. We're going to move on to preparing our metoprolol. So again, we just wanted to check. We already checked that was metoprolol that we're going to use. It's not expired. We do need to cut a pill in half based on our calculation to make that 75 milligrams. So for tablets and capsules, you can use a paper cup because it's not liquid. And again, remember for our oral suspensions, we used a syringe because it was 10 mLs or less. So 5 mLs, we're going to use an oral syringe, certainly. Okay, so I'm going to open up my container here. Ideally, you can transfer the tablets into the cap of the container and then into your med cup. So we put one into the med cup. So that's our 50. And this one we're going to transfer. This is our pill splitter, so it's kind of got that razor blade. We're going to put our pill on there. Generally, actually, it's helpful to have it go on there that way, so the scored marking can be lined up. If your hands are clean, you can touch most pills. You just want to make sure your hands are clean, and you can maybe transfer it that way just to line it up a little better. Or you can line it up like that, and then you're just going to close it on it. And one made a clean break, and one was not so much, so I'm going to take the one that broke cleanly. And this pill will get disposed of into our med waste container. So in our case, we use broken tablet cups in lab for them to get disposed of, but generally there's a med waste container in most med rooms, and we're going to close up our pill splitter. And you'll notice that I'm not putting away the medication containers that I'm using. I'm just putting them aside, and you'll see why in a second, or in a minute here. And again, I want to make a label immediately for that medication that I just prepared. So I'm going to put the patient's initials here at the top. The drug name is metoprolol. The dose is 75 milligrams. The volume, it doesn't necessarily always feel like it applies the same to pills as it does to liquid, but you want to include the volume of tabs here. So we have 1.5 tabs. Diluent amount doesn't apply. Concentration, we can say 50 milligrams per tab, and this will just allow you to better kind of recalculate, if you will, when you get to the bedside, that makes sense that you have, they were 50 milligram tablets, so you have 1.5 for your 75. You're going to put the date and time that you prepared, 0812, and your signature or initials at the bottom there. And you can just place it on top of that, the med cup on top there. And the next medication you're going to prepare is the ciprofloxacin. So again, we checked that that one was correct, the eye drops. So you're not going to transfer this ciprofloxacin into another container. We're going to use it directly out of this eyedropper. In the case of ophthalmic drops or otic drops, it's going to be patient specific. So this is going to be just for this patient. So you should make a label still for it, but essentially we're going to be bringing this container into the patient's room. So I'm going to put again the patient's initials at the top. The drug name is ciprofloxacin. And as you can probably imagine, the 5 rights don't necessarily apply to eye drops the same way, or as nicely, I should say, as they do to oral and other routes of medications, but we will make it work and make sure we have all the necessary information. So the dose was 0.3%. So the volume for the eye drops is 2 drops, so 2 GTT, and then it's going to go to the right eye, so you can kind of include that there too. It's not a bad idea. And they're going to get it twice daily. And then I'm just going to put the date and time and my signature here. And then I'm going to put the container on top of that label and put it aside on the tray. Next is the metronidazole, and similarly to the ciprofloxacin eye drops, oftentimes a cream like that would be patient specific, so we're going to bring the container in with us. If you wanted to transfer it into a clean med cup, if you knew kind of how much you were using, you could do that too. The other thing that we'll probably use for our topical cream is Q-tips, so you can get a pack of sterile tip applicators, or we could wear gloves to apply. It kind of depends on the patient and the area that it's going on. So we're going to make our label with our patient's initials here, and the drug name, metronidazole, and the dose 0.75%. Volume doesn't really apply to this one, neither does the concentration. So we're just going to put the 2 rosacea affected areas there. And again, he's just going to get this one daily, so once in a day. So we'll put that down there. So now we've prepped all of our medications. We did our first check. We prepped all of our medications and immediately made labels for them. Now we're going to go over the process of second check. So remember I said we had you're putting your containers aside but not yet putting them away, and now we'll explain why. So when we do our second check, we're checking a couple of things. We want to check the container we took the medication from with the MAR, with the container that the medication's in, so the oral syringe, for example, as well as the label. So you kind of want to bring all those things together. And we're going to go through those 5 rights again. So right patient is Adolf Harrison, so we have his initials here, Harrison Adolf, the way it's written. And the right drug name is ibuprofen. So we want to check our container, it is ibuprofen, and we want to check our label for the right drug, ibuprofen. The right dose is 100 milligrams, so we want to check our container, 100 milligrams per 5 mLs of ibuprofen, and we want to check our label here, 100 milligrams per 5 mLs is the same. And then you also want to verify what's in your container, syringe, etc., that it's actually correct. So we're at the 5 ml mark, because you would be surprised, your eyes can play tricks on you, and all of a sudden you don't have 5 mLs in there, you suddenly have 6. Etc. So you just want to make sure. So we're verifying our correct dose. And then the correct route is PO. So this is an oral suspension. So PO, it's in an oral syringe. And we can grab a cup of water for them to wash it down with. Not a bad idea to have. PO, and then right time and frequency. Again, just want to make sure that you're giving it at the right time, 08:30, and they had it 6 hours ago. So that's correct. So we've done our second check for the ibuprofen, and we're going to put that one away. The next drug we're going to check is the metoprolol. So again, we have our MAR, we have our label, we have our container of medications, and then we have our container where the meds came from. So right drug, metoprolol, right patient, Adolf Harrison. So we have their initials at the top here, HA, Harrison Adolf. Right drug is metoprolol. So we have metoprolol here, and we have metoprolol here on our label. Right dose is 75 milligrams. So we have 50 milligrams per tab. So 1.5 tablets should give us 75. So dose here is 75 milligrams, volume 1.5. So we just want to check and verify that yes, we do in fact have 1.5 tabs. So we have the right dose. The right route is PO. So they're oral tablets. And again, we have that cup of water for them to swallow. So oral tablets, and we're going to give them once daily. So at 08:30 is when they're due. So we have the right second check of the metoprolol. Next, we're going to second check our ciprofloxacin. So again, we want our container. In this case, the container is going to come with us to the bedside, and the label. So we're going to check that. First, we have the right patient, so Harrison Adolf, we put their initials here. We have the right drug, ciprofloxacin. So ciprofloxacin on the MAR matches the ciprofloxacin on the container. The right dose, right drug on our label is ciprofloxacin here as well. The right dose is 0.3%, so dose 0.3%, and on our container is 0.3%. Eye drops is the right route, so ophthalmic, and we wrote that on our container or on our label here as well. So ophthalmic and 2 drops to right eye. And then so the volume we're going to give is 2 drops to the right eye, and we're going to give it twice daily, so at 08:30 and at 20:30. And we have our cotton ball and gloves for that after. Next medication is the metronidazole. So we're going to check right patient, Harrison Adolf, right drug name, metronidazole. So right drug name, metronidazole, and right drug name on our label, metronidazole. Right dose is 0.75%, 0.75%, right dose, 0.75%. It's a topical cream, and it's topical here. And we've written on our label that apply daily to acne rosacea affected areas. So I'm just going to put, we didn't put our signature and date on this one, so we'll just add that now. Okay, so now we've done all of our checks. Some of the containers, again, we're bringing to the bedside with us. Some we're putting away. Before we leave the med room, just want to make sure we have everything we need to bring with us to the bedside. So we're going to bring our MAR, of course, with us to the bedside so that we can verify our medications one more time and that we have the right patient. We're going to bring our meds with us to the bedside. We have gloves, water, cotton ball, and cotton-tipped applicators for the cream. We can wash our hands again before leaving. And not a bad idea to bring your pen as well so that you can do right documentation immediately at the bedside when you're done. So now we'll just take our stuff over to the bedside. So as I go to enter the room, I'm doing a quick safety check. So mainly looking at the patient, making sure the patient isn't in any sort of distress or extreme discomfort, that the bed is in the lowest position if they're in bed, and that the call bell is within reach, and there's no hazards for them. So then I can fully enter. Hi, Adolf or Mr. Harrison, my name's Aaliyah. I'll be your nurse today, or student nurse today. And you can put your stuff down here on your bedside table. And not a bad idea to bring your MAR over to your patient. Can ask them things like, how are you doing today? Assess their level of consciousness and their response to you. But we're going to focus on the med admin piece for now. So again, Mr. Harrison, my name is Aaliyah. I'll be giving you your medications today. I'm just going to verify your ID bracelet. So you want to actually have a look at their ID bracelet that they're wearing and compare it with your MAR. So we have Harrison, Adolf, and you can check the fin on here. So 1, 2, 3, 1, 2, 3, 4, 5, 6. 789, and the birthday, January 3rd, 1946. Yep, that's correct. And then you also want to get them to verbally state their name. So you don't want to say, "Are you Adolf Harrison?" because it's too easy to say yes to that if the person's confused. Maybe they didn't hear you. Maybe it sounded like their name. Maybe they just don't want to offend you, thinking that you are confused. So you want to actually have them, you want to say something to them to the effect of, "Can you say your full name to me?" and have them actually say it. So, yep, he says his name's Adolf Harrison. Great. And you always want to verify with a second identifier. So, can you tell me your date of birth? January 3rd, 1946. Perfect. That's what we have here too. So you want to use a unique identifier like full name and birthday because people generally know that information. Most people don't have their FIN memorized, so that's not a good unique identifier to ask them to verbally say to you. But it is one that you can check with the FIN. So you want to do both the wristband check with the MAR and then also that verbal verification with two unique identifiers again. So we've done that. Now, because we've already started dialoguing with the patient, is a great time to ask, do you have any drug allergies that you know of or any allergies at all that you're aware of? No, you don't? Okay, great. That's what we have here too. It's a good time to check that just in case the patient forgot to tell them in another department or when they were admitted on your unit. You just want to double check or it wasn't recorded properly. So good, we know that we now have the correct patient and that he does not in fact have any allergies. So now we can either stay here sort of at the end of the bed to make sure that we don't forget to do that third check before we start giving medications. So Mr. Harrison, I'm just going to double check that I have everything here before we start administering your medications. Is that okay? Perfect. So we're going to follow that same process and procedure. So we know we have the right patient. We verified that, so that's Adolf Harrison. And we're going to grab our first medication. So right drug, ibuprofen. Right drug, ibuprofen. Right dose is 100 milligrams. So we have 100 milligrams here per 5 ml. So we want to re-verify. Yep, we have 5 mLs full to the top. Right route is PO. So oral, so we have a cup of water to help him wash it down, and it's in an oral syringe. Right time and frequency is every 6 hours. So we last got it at 02:30. He's going to get it again now at 08:30. Perfect. So we've third checked our ibuprofen. We're going to third check our metoprolol. So we know we have the right patient. We verified that. Right drug, metoprolol. Right drug, metoprolol. Right dose, 75 milligrams. So right dose, 75 milligrams, which is equal to 1.5 tablets. Whoops, which we have in here, 1.5 tablets. So we have the right dose, and it's going to be given orally. They're PO tablets. So we have our cup of water. So that's the right route. And right time and frequency is daily. So he's getting it once at 08:30. Which we are giving it at 08:30 with his other meds. And they are 50 milligram per tab, so we can actually recalculate that 75 milligrams again, as we indicated for ourselves. Next drug we have, so we again know we have the right patient. Right drug is ciprofloxacin. So right drug here is ciprofloxacin, and we can recheck our container in this case. Ciprofloxacin. Good. Right dose is 0.3%. So we have 0.3% on our label and 0.3% on our container. It's going to be 2 drops to the right eye. So the volume is 2 drops. The right eye is the correct route. So we've written it on our label here. And right time and frequency is going to be BID. So the right route of eye drops, it also says on our container ophthalmic. So we know we have the right container. And finally, we're going to check our flagell. So we know we have the right patient again. We checked that. So right drug is metronidazole. So right drug name, metronidazole, and that's the same as what's on the container. Right dose is 0.75%. So right dose, 0.75%, and that's the same as what's on the container. And right route is going to be topical, so it's a topical ointment, and we're going to be applying it to rosacea affected areas. So we've documented that on our label. And right time and frequency is daily, so he's getting it again at 8:30 once daily. So now that we've done our third check, we know that we have all the correct medications. We can sort of start our administering, making sure that we're doing the proper assessments first. So I'm going to make sure that I identify each medication before I give it. I explain why we're giving it to the patient. So you want to name the medication, why you're giving it to the patient, any side effects that they should be watching out for. Making sure to mention that side effects aren't normal and they should let you know if they experience any of those side effects. Some being more severe, of course, that you're going to be watching for. You're also going to want to let the patient know, but also your buddy nurse or CF, etc. And then eventually you'll just kind of start saying it to yourself, but what you're monitoring for. So if we're checking, say, for example, their vital signs before, which ones in particular are we going to be paying attention to? So what you're monitoring for before giving the medication, as well as afterwards. What are you wanting to see happen and or not wanting to see happen? Another good idea to sort of add in your dialogue about the medication for the patient is any sort of applicable patient information that they may need to know or want to know about the drug. So first thing, we're going to actually sit you up a little bit, Adolf, if that's okay. So we're going to raise the bed a little bit and also definitely raise the head of the bed because a lot of the medications we're giving are oral. So we're going to raise the head of the bed here. We'll sit you up as high as you can, so a high fellers, so that swallowing is safe. So first med we'll start with is the ibuprofen. So ibuprofen is an analgesic or a pain medication, and that's why you're getting it. It's to relieve your osteoarthritis pain. So you're getting it regularly every 6 hours. Some side effects you may experience are dizziness or drowsiness. Also, another side effect you may experience is abdominal pain or cramping. Let me know if you have any of those side effects or any side effects you think might be related to the medication, and we'll look into it. I'm going to be monitoring your pain, of course, before giving the medication and then after, so checking the pain scale, asking you about the pain, and making sure then afterwards that it's gotten better. With this medication, it's also important that we monitor your fluid balance, your ins and outs, etc. So we'll be watching your blood work and then how much you're consuming and then putting out as far as fluids. Some things you might want to know about this medication is that it can be taken with food or milk, but it is best on an empty stomach, so waiting about an hour or two before or after meals and taking this medication. Be careful with position changes after taking this medication, again, in case you have that dizziness or drowsiness side effect. You just want to be mindful that you don't get too dizzy and then fall. So we're going to give you this. Would you like to take it in the oral syringe, or do you want me to transfer it to a med cup? The oral syringe is okay? Perfect. I can help you do it here. So we'll squirt it in. Do you want a little bit of water to swallow it down? Perfect. And you swallowed it okay? Perfect. So we'll discard that one. So the next medication I'm going to give you is your metoprolol. So metoprolol is a beta blocker, or you probably know it as an antihypertensive or a blood pressure pill. So it is going to lower your blood pressure. So it may also lower your heart rate. So some side effects when we give a medication like this is that you again may feel dizzy or drowsy, especially if that blood pressure, heart rate go a little bit too low. So let us know if you experience any of those side effects. You may also feel fatigue or weakness. So again, let us know. I'm definitely going to be monitoring your blood pressure. I'm going to be checking it now before I give this medication to make sure it's not already too low and that it would be made lower and you could become dangerously hypotensive. And same, I'm going to take an apical heart rate before I give this medication. We want to make sure that your heart rate is above 60 beats per minute before giving this medication, again, because it can lower it and we don't want to get you into dangerous levels of bradycardia, which means slow heart rate. So I've checked your vitals and they're all stable, and you can be given this medication now. Some education that I might want to provide with this medication is don't skip doses. You want to make sure you're taking it at regular intervals when you're at home and you're not missing any sort of doses, or you won't get that control. So we'll give you your metoprolol here. Again, it's oral pills. It's 1.5 tablets. You can just swallow that. And would you like some water? Good. And that went down okay. Excellent. So the next medication we're going to give you is your ciprofloxacin eye drops. So ciprofloxacin is an antibiotic. So you have a conjunctivitis, which means an eye infection in your right eye. So we can see that your right eye is a little bit more closed and pussy. So this is going to help clear that infection of your right eye. So with the antibiotics, some side effects you may experience are blurred vision, eye irritation, pain, itchiness. Please let me know if you have any of those side effects that, like eye irritation, itchiness, redness, that are excessive and very irritating. It could mean that you're reacting to this medication, so we want to avoid that. Some things we're going to monitor for, of course, are for worsening or hopefully improvement of that eye infection, making sure that the pus is going down. We may also want to monitor, we would want to monitor your vital signs generally, but especially paying attention to temperature in case that infection is spreading. And in an extreme case, maybe going systemic, but generally we're just going to be keeping an eye on that eye. So some patient education that I may want to provide in terms of eye drops is your eye actually can handle up to 2 drops, and I'll review with you how to deliver them to yourself if you're going to be doing that at home. If you do wear contact lenses, are you wearing them now? No? Okay. If you are going to be wearing them at home, you want to make sure that they're out before you give yourself this eye drop because it can interact and sort of have negative interaction. So I'm just going to apply my gloves here. And we want to make sure we have the correct eye, and in this case that's the right eye. So it sounds kind of silly, but it can help to sort of position yourself in a similar position to the patient. Make sure you're not giving it in the wrong eye. So this is his left side, this is his right, so I'm going to be giving it in that right eye. You'd be surprised how often eye drops go into the wrong eye, and that's then considered a med error. So we're going to open up our container. Can put the cap down on the table. You can put it down on its side or upside down if it'll stay. Some of them are sort of curved on the end so it won't, but just to help prevent any bugs from getting in there. We're going to pull down on the conjunctival sac here. Jake doesn't really allow us to do that. And you can rest your hand sort of on their forehead and drop from above, and you're going to do 1-2 drops into the conjunctival sac. So just that sac kind of underneath your eye. So we want to make sure we give the 2 drops that are ordered into the right eye. And actually before putting the cap on, you want to help your patient here and actually apply a cotton ball there. Cotton ball is good because it'll absorb any excess solution that sort of dripped down or is going to drip down, but also has the dual purpose of we can actually use the cotton ball to apply a little bit of pressure at the lacrimal duct or the tear duct here. And what that does is it prevents the medication from absorbing and going systemic. So with an antibiotic, we are giving it again just for that local eye infection. We're not giving it for any other type of infection. And if we were, we would do a different route such as PO or IV. So we're giving it just to act in that eye. So to prevent it from acting on the rest of the body, we're going to hold pressure there for about a minute, and it allows it to just absorb in the eye and then not go systemic. That idea of holding on the tear duct for eye drops becomes crucially important when we're talking about medications such as anti-glaucoma eye drops that can actually affect the patient's blood pressure and heart rate if they go systemic. So especially in those cases, you want to make sure you're educating the patient or doing it for them as required, that holding there for a minute. Because if you can imagine, if they didn't need their blood pressure lowered that much and an eye drop acts systemically, they will feel dizzy, lightheaded, and they may even have issues with level of consciousness if their blood pressure is too low. So just keeping that in mind, if we want the eye drop to just act locally on the eye, we will hold pressure there for about a minute. So we're done with your ciprofloxacin. Gonna throw out our gloves here and clean our hands. And finally, we're gonna give you your metronidazole cream. So we'll just move these out of the way. So your metronidazole is a topical ointment, and it's going to go on your, it's a topical ointment that's actually an antibiotic for rosacea, which you have on your cheeks there. which is where it's prescribed to go. Some side effects you may experience, but we want to make sure you don't experience, so let me know, is excessive itching, any sort of rash in the area where we put the cream, burning, sores that develop. Definitely let us know if that happens. Things we'll be monitoring, again, with this local type of acting cream, we want to just make sure that acne rosacea is getting better and feeling better, and not getting worse. So we're kind of monitoring for treatment effect. And some patient education we may want to provide is how they can best do this at home. So making sure their hands are clean when they're doing it, and making sure the skin is clean, and that they're not inadvertently washing it off after. And also making sure that if they are applying it, say with their fingertips to their face in this case, that they're then washing their hands off well afterwards, because you don't want to get this medication into your eye. So if you had it on your finger and then you rubbed your eye, that wouldn't be good or comfortable. So you want to avoid that transfer. So we're just going to apply the ointment here. I'll put the cap down again on its side or upside down. Apply the ointment. And then we're going to apply it to the acne rosacea areas on his skin. Good. And again, we'll throw out the dirty gloves and recap here, tidy up a bit. Always, anytime we remove gloves, we're going to clean our hands. So you're doing okay, Mr. Harrison? Perfect. Okay. So I'm just going to sign my MAR before I leave your room here. So this is right documentation. So you want to make sure when you're signing the MAR, you're signing in the right time column and date. You're signing with your initials. And for students, you definitely want to sign with your designation. So that's UMSN2 with the Roman numeral 2. And then it's not a bad idea to include the time. So we're giving these at 08:35. And the next we gave the top roll, so your initials, UMSN2. And the time you gave, 08:35. And ciprofloxacin, same thing, UMSN2, 08:35. And again, the time is a little bit of an approximation, as you can imagine. I didn't give them all at the exact minute, but I gave them sort of in the same set, so it's okay to write the same time. And make sure you're writing correct 24-hour clock time without that colon, and you're writing the correct time in military time. And we can also initial and sign the signature record at the bottom here. So I'm going to put your name and designation there. Most places that's actually in another spot of the chart, but that's okay. We can put it on here. So we've signed our MARs, we've done correct documentation. We're going to return our patient to a comfortable position. Depending on the meds we just gave, especially it was quite a few oral meds, he may need to stay sitting up for a few minutes, but we will lower the bed to a safest low position. The call bell is here beside you, so please give us a ring if you have any of those side effects that we talked about, or any other side effects or concerns that you want us to come back and assess. I will come back and monitor your blood pressure, heart rate, temperature. We'll be watching your blood work, like I said, and your ins and outs as well. So you're in a safe and comfortable position. You're feeling okay. You've told me we're going to do an exit safety check as we leave. Make sure you have access to anything you need, like a urinal, for example, or water cup, so you don't fall trying to get those things. Again, your call bell is there. All right. Thank you, Mr. Harrison. We'll see you in a little bit.
No rhythm offensively. It really seemed to confuse Tyler Murray. The fact that everybody stepped up on both sides of the ball was drive.
So, I hope you all can take something away from that video. It really goes through step by step of what we should be doing. So, the big takeaway from all of this is that we really should be performing all of the 6 rites every single time. When we come back from our next little break, we're going to go over storing medications and storing medications safely.